professional interests include culinary medicine, physician wellness, integrative oncology, mind-body medicine, and obesity. Dr. Mahadevan works at the LSU Cancer Center, where she runs shared medical appointments in the Lifestyle and Integrative Medicine Clinic focused on cancer survivorship and well-being. Her interests in mind-body medicine include yoga, meditation, and clinical hypnosis. She's also started a weight management clinic to support children suffering from obesity and has introduced culinary medicine into the medical education curriculum. Today, she's going to be talking to us about what is mind-body medicine. Welcome.
Good afternoon. Thank you so much for joining us today. Our team at LSU is very excited about sharing tools we use in our head and neck survivorship clinic for cancer patients. We've had some great feedback and improved outcomes with our patient population, so we hope to share a couple of great resources with you guys today. Sometimes we all need a little levity, but today is really about bringing us back to the present moment. And we found through focusing on the here and now and not thinking about the past or the future, we can better regulate our emotions. So survivors are now being termed thrivers, and we really want to think about what constitutes well-being. The World Health Organization put out a great series a few years ago talking about 4 main components for happiness and well-being. And these 4 components that make up happiness is our impact of resilience and emotion regulation, impact on positive outlook, impact on attention, and our impact on generosity. If we look at this a little closely, we can see that when it comes to about well-being, we have to have coping strategies, which we know now can be taught and acquired to build our resilience. We also have to focus on gratitudes, and scientifically, when we focus on what we are grateful for, our brain releases neurotransmitters and hormones such as dopamine and serotonin, which are critical to help us regulate our emotions better and also have a role in pain control. We also have to think about how we focus our attention and bringing in mind-body therapies, which we can train our brain to do. And we have to have a positive outlook. When we start thinking about the biology of belief, when we think that we're going to get better, our body often follows. So it brings me to the idea of what is mind-body medicine. So we have to take into account that you as a person are made up of so many different factors: how you think, the way you feel, the way you behave, and how that impacts your overall health. We know that there are certain practices which enhance your body's ability to stay present and build resilience over time. And these techniques can also physiologically improve your body's ability to cope with things like pain, stress, and mood disorders. In the cancer space, the most well-known quality control studies which demonstrate mind-body medicine are in the realm of how it can relieve anxiety and stress over time, how it can improve overall quality of life, and also how we can improve insomnia and improve our energy levels. There are many techniques that improve mind-body connections, including yoga, guided imagery, meditation, massage, biofeedback, which is a practice to help regulate our heart rate or body temperature, and clinical hypnosis. One of our big governing bodies is the NCCN, the National Comprehensive Cancer Network, and they've provided us with a lot of information that some cancer centers are now utilizing when it comes to integrative therapies to support our cancer patients' better function. And we know that exercise and acupuncture are the top 2, and they're very well utilized for our survivors, but a close second includes meditation and yoga, followed by massage and music therapy. So when we think about yoga, we really have to think about it as a philosophy. And in meditation, the mind relaxes and the body follows, whereas in yoga, the body relaxes and the mind follows. Yoga therapy is a process of really empowering individuals to progress toward improved health and well-being through the applications of teachings of yoga practices. sorry, get ahead. So when we think about all the different clinical applications for yoga, we know that it's really well studied in the survivorship space for anxiety, depression, sleep disturbance, memory, lymphedema, pain, overall quality of life, and finally improving our ability for strength and flexibility. Yoga is a category 1, which means it is a great recommended therapy for cancer-related fatigue. And we also know there was a great study that came out of MD Anderson that group yoga can affect cancer patients and caregivers. And research suggests that yoga can lead to improvements in not only mental health, but overall quality of life, sleep disturbance, physical functioning, providing more meaning towards the experience of being ill, and of course, stress regulation. And it's not just for patients, it's also for family members as well. And we know they're a big part of this journey. And if we can prevent caregivers from having stress, then that also improves the patient's experience as well. Our next mind body therapy to discuss is clinical hypnosis. So this is also a therapy recommended by the NCCN. And we have to think about it as a state of awareness that brings about a trance. And it really opens the doors to new experiences in suggestibility. For our patients at LSU, it's really helped with dry mouth and taste changes especially. Because we started seeing the impact of clinical hypnosis on our patients, we are now studying how hypnosis is doing this. And we're recruiting head and neck cancer patients with dysphagia, with pain and dry mouth, and having them listen to audios and see what is the dose for hypnosis that can have a therapeutic effect. And there's been a couple of great studies in the head and neck cancer space that shows that yoga was had a great synergistic effect post radiation along with pain medication, and it's also been shown to be helpful for managing dry mouth as well. Clinical hypnosis applications that are also studied in the cancer space have shown its improvement with pain, irritable bowel syndrome, dry mouth, self-image and self-worth, procedural discomfort, headaches, anxiety, and overall immune support. There some upcoming research coming out of other cancer centers. Mayo Clinic is doing hypnosis for patients pre and post procedures, which has in pilot studies shown to be effective. And MD Anderson is also using hypnosis for small breast cancer procedures, which has also been helpful. So I think we know that some of these mind-body tools are underutilized, and we hope to showcase them for you today to demonstrate its salubrious qualities. And a few resources.
Wonderful. Thank you for that. We have a couple questions that we're going to save for the end, but I am taking note of them all. So everybody keep them coming as they come up. Next, we have Dr. Gupte. She's a board certified clinical hypnotherapist, and having practiced family medicine for over 15 years, Dr. Gupte has let go of her stethoscope. She felt a void practicing as a physician, treating just the symptoms and not the cause. This made her think outside the box, and she entered into the field of clinical hypnotherapy. Dr. Gupte currently specializes in providing online hypnotherapy as a mind-body solution for those facing the challenges of chronic disease. She is an international best-selling author of the book titled Within, and her book is filled with case studies as evidence to showcase hypnotherapy as the mind-body approach to deal with chronic ailments differently. She's also the founder of a nonprofit organization, Mind Medicine Movement, and the mission of this organization is to help manage chronic ailments through specifically designed mind-body hypnosis protocols and to bring forward more evidence-based research in the field. Dr. Gupta is going to give us an introduction on understanding hypnosis, and then we'll go from there. Thank you.
Thank you so much for the introduction, and thank you so much for this opportunity. And I would like to welcome all of the attendees. We are all survivors of life. So of course, my topic is related to clinical hypnosis. And I would like to take it forward from what Dr. Mahadevan has already shared with us. And just to understand our thoughts contributing to the disease. It is almost very well known in the field of science. Research has proved and shown that humans generate thoughts almost like a computer. 50 to 60,000 thoughts are generated in a day on daily basis. Some of these thoughts are connected to certain emotions. Sometimes these emotions are not very pleasant emotions. And if you look at emotions, it is nothing but energy in motion. And when we feel an emotion and we are unable to either express it or vent it out or dissipate it properly, of course, this energy is felt by the physical body. And just imagine if we encounter these emotions, these unpleasant emotions on daily basis, this energy continues to flow in the body. And in a way, the body has to bear the brunt of all this energy. And one fine day, we get a label of a dis-ease. There is a clear connection between mind and body, though it is somewhere not quantifiable, but the connection is there. And of course, just to showcase the research, if you look at the first slide, it is showcased very well there that people who suffer from chronic ailments also have issues related to the mental health. If you look at the population with Parkinson's, almost 50% were diagnosed with major depression as well. Cancer, 42%. And these numbers continue to grow. The mind and the body are connected. What affects one affects the other. The second slide here shows you how the study was done in UK, where they showcased that the population suffering again from chronic ailments also had mental issues. Since I will be talking about clinical hypnosis, I feel it is very important to understand what mind is all about. I'm often asked this question, is mind the brain? Are they the same? So to explain and understand what is the difference between the mind and the brain, I would like you to imagine perhaps your laptop, your Mac. The laptop, of course, has a hardware and there is a software which runs this laptop, the iOS. So imagine your brain being the hardware, your laptop, your Mac, and the iOS, your software, is your mind. And in the software, when we talk about the mind, there are very two clear categories which we often speak of, the conscious and the subconscious. And I'm pretty sure many of you must have seen this image. When we describe the subconscious and the conscious, we look at it as the tip of the iceberg. And there is much more underneath, under the conscious. The subconscious is that part of the mind through which we analyze, we decide, we make day-to-day decisions, logic. That is the capability of the conscious mind. The subconscious, which is much more powerful, much more bigger than the conscious mind, is mainly responsible for survival instincts and for the memory. And many times it is perceived as if being in the subconscious is like going to la la land, but it is not so. I would like to bring your attention to how we go in and out of the conscious and subconscious almost on daily basis. Say for example, has it ever happened to you that of course you have a particular route you take from home to go to work, and one fine evening, you are driving back home, but you are so engrossed in your thoughts that you don't even realize when you reached home, as if almost you were on autopilot. You were somewhere in an altered awareness. Or maybe you are walking down the street, just taking a stroll, and there is a new bakery which has opened up, and you smell something which immediately takes you back in time to your grandma's kitchen. And you perhaps lose track of time in that moment. That altered state of awareness is where we are in the subconscious. When this altered state of awareness is created in a clinical setup, it is called clinical hypnosis. When we are using clinical hypnosis, we are accessing the subconscious mind to work on negative emotions, behaviors, physical symptoms, to create changes which we are consciously unable to do. when we do therapy in this altered state with heightened awareness and focus, it's called clinical hypnotherapy. And once again, it is not in general awareness that clinical hypnosis has been in the medical field for over 200 years. In the 1800s, there was no anesthesia, and the mortality rate from surgeries was used to be very high. And in those times, forward thinkers, surgeons like John Elliotson and James Asdale used to use hypnosis to perform pain-free surgeries. There is a record of over 1,800 surgeries, successful surgeries having been performed in those times under hypnosis. And from there, the medical world continued to be interested in the field till World War II, when we somewhere lost it to the magicians. And it became a tool of entertainment and had a different limelight altogether till late 1900s, when medical world picked it up again, and a lot of research was done in this to showcase once again that hypnosis is clinical hypnosis. It is not mind control. It is very different from the entertainment side of it. In clinical hypnosis, as I said, the control is absolutely with the patient, and we guide the patient to do the changes which consciously he or she is unable to do. Fast forward to the current status, as Dr. Mahadevan shared as well, NCCN has included hypnosis in their guidelines to counter neuropathic pain and hot flashes in women. And continued work is being done because this is the biggest resource we humans have, the power of our mind. What all we can do, how we can utilize, how we can harness this power of mind to shift the negative emotions, the physical pain, it continues to get studied and researched. So let's dive deeper into understanding the mind-body negative loop. We have understood that the mind and body are connected. What affects one affects the other. So what exactly is this loop? On day-to-day basis, through different experiences, we perhaps feel different emotions like fear, maybe sadness, guilt, shame, and due to culture, due to society, many times we do not get the opportunity to express these emotions, to vent it out, or to dissipate it in a proper way. And as we keep these energies within us, it keeps on hitting the body. Has it again ever happened that you have a not so pleasant relationship with someone, and whenever there is time to encounter this person, you have a sinking feeling in your gut, or it is a presentation which you feel that you are not very well prepared for, a situation you are not very well prepared for? The moment you think about it, once again, perhaps your migraine kicks in. The moment there is something unpleasant, we feel the emotion, the body reacts to it. And the moment the body reacts, the mind goes even more in distress. Have you ever felt that when you are in physical discomfort, your focus is not there? You are unable to perform the task at hand with precision. And because you are unable to do that, there is even more stress and anxiety. And this loop keeps on circulating within us because we don't understand how to let go of these emotions, what exactly we can do. And this inner restlessness, to cope up with it, as humans, we try our best and different coping mechanisms kick in. Perhaps it's emotional eating, perhaps it's addiction, smoking, alcohol, substance abuse, because there is inner restlessness. The person does not know how to get rid of it. And the moment these self-sabotaging habits take over, this loop has gotten even more tighter. And as I said, the emotions continue to hit the organs, continue to hit the body. How do they affect the body? As per ancient alternative healing modalities like traditional Chinese medicine and Ayurveda, anger harms your liver, sadness affects the lungs, worry affects your digestion, your stomach. Stress, of course, we know, harms the heart and the brain, and fear affects the kidneys. There is a direct relation to which emotion affects which organ in the body. And as we stay trapped in this negative loop, the dis-ease continues to grow. And if at all there is a negative loop and mind, thoughts, emotions are contributing to that dis-ease, what exactly is the solution? I personally feel if the problem originates from within, the resource, the solution is also within. And of course, I'm not here just to create awareness, but to provide solutions as well. So to break the negative, what is the opposite? Of course, the positive. And I would like to talk about Dr. David Hawkins' work, research, decades of research, where he showcased that emotions play a major role in different levels of consciousness. Please focus at the bottom here. If you see here, emotions like fear, grief, apathy, guilt, and shame are very low vibrating emotions. When we feel them, we are almost in a state of inertia. We are stuck. We often use the term, I'm feeling very low. I don't feel like doing anything. As opposed to if you look at the top of this pyramid, emotions like peace, joy, gratitude, and love are very high vibrating emotions. These emotions are often can be described as waves. When you feel happy, you cannot control it, you cannot contain it. You feel it and it goes away. As opposed to the low vibrating emotions, which are almost like rocks. When they come, it is very difficult to shake them off, to move out or move away from it. So what we are going to do today is we are going to use the positive to counter the negative, the high to fill up the void of the low, following the law of nature, just like a waterfall. And as I said before, we all have experienced things which made us feel the fear, sadness, grief. But also there were moments where we felt gratitude. There were moments where we felt really happy and joyful, but easily forgotten. So we are going to create a positive mind-body circuit through the experiential exercise I'll be leading all of you to after Megan. And through this mind-body positive circuit, through daily repetition, you are going to rewire the mind to bring the ease to the body. I've created a slide. I like to showcase the representation of what exactly we are going to experience. And it's easier to flow through with the exercise once you have a visual of it. So I'm going to, through mind-body hypnosis, I'm going to guide you to scan the body through the eyes of the mind. From there, we are going to connect with positive, happy memories. Perhaps they are long forgotten, but they are there in your data bank, in your subconscious. And as you connect with these memories using guided imagery and your imagination, you are going to connect, create a bridge from these memories to the body, connecting it to the heart. And from the heart, these energies are going to flow, bringing that equilibrium in the body. So this is the experiential part, which I will be taking you all into, the inner journey. I would like you all to keep this image in your mind. We are going to create an anchor through this particular position of your hand, touching the thumb with your index finger. Imagine this is going to be your switch on and off to get this circuit going. So I'll be leading you to all of these steps. Once Megan has worked through her magic to relax the body, I'll be taking over to relax the mind. And thank you so much.
Great. Thank you, Dr. Gupta. That's great. And we're getting a lot of fantastic feedback from the attendees. So please keep your questions coming. Next, Megan, who I'm going to introduce quickly, is going to do an experiential with yoga. And then directly after her yoga session, we're going to go right into Dr. Gupta's hypnosis experiential. So then after that, we'll have opportunity for questions and answers. So up next, we have Megan Filer. She's a massage therapist, yoga instructor, and registered dietitian. She's been actively practicing as a registered dietitian with a focus in the oncology, critical care, bariatric, and cardiac rehab patient populations in Shreveport, Louisiana for the last 7 years. She became stress management specialist with the Ornish Cardiac Rehab Program in 2018. Megan is passionate about the delivery of evidence-based protocols to improve quality of life and outcomes for the patients that she sees at the Feist-Weiler Cancer Center with an integrative medicine focus. Please welcome Megan as she walks us through that yoga session, and then we'll quickly follow that with a hypnosis experiential with Dr. Gupte. Thank you, Megan.
Hello, everyone. I'm so excited to be with you. I'm so honored and very excited to answer some of the questions that I've seen at the bottom. So my goal is to take you through a basic sequence of deep breathing and then the physical postures of some yoga that may help with any kind of ill effects from the treatment. We focus on a lot with radiation fibrosis and lymphedema. And the way that yoga can impact these symptoms is that it changes your range of motion and it helps to affect the tissue, creating space and elongation of the muscles. We can change the way that your circulation flows. So anytime that you have swelling in your head and neck, your shoulders, your arms, that's a side effect of lack of circulation that is called lymphedema. And we know we can affect that with physical manipulation like massage therapy, or from internally moving your muscles to create circulation that allows that lymphatic system to drain. So we use yoga quite frequently in our survivorships to help affect those two side effects frequently. So for this session, I'm going to have you get into your chair. Go ahead and slide your hips all the way to the back of your chair. I'll scoot back a little bit so that you feel your hips supported at the base of your chair. Then allow your hands to come to rest on your thighs. Gently close your eyes. Take a few slow, deep breaths in through your nose and out through your mouth. Again, in through your nose and out through your mouth. As you exhale, start to feel the weight of your body sink down into your chair. Allow the heaviness of your legs and your hips to relax down. Feel your shoulders, your neck, your head relax as the muscles of your face, your jaw, your tongue, and your throat soften and let go. With your inhale, start to bring yourself into your body. Start to notice, bringing your awareness down to your feet and allowing it to scan up through your legs, to your hips, your lower back, up through your spine, all the way to the top of your head. Notice if there are any areas of tension or discomfort. With your next inhale, start to bring your awareness to your mind. Take a moment and notice how you feel right now, your level of energy. And then with this awareness of your body and your mind, begin to notice your breath without changing or judging. Notice how and where that breath flows in and leaves. Start to notice the rate of your breathing, the depth and the ease. Notice what parts of your body move as you inhale and exhale. And when you're ready, we'll begin to breathe with intention. Bring your right hand and place it over your heart, and then take your left hand and place it on your abdomen above your navel. Let your hands rest heavily on your torso so that you can feel the weight of your hands against your chest and your belly. Take a few slow, deep breaths and notice how your hands will rise and fall with your inhale and exhale. When you're ready, closing your mouth so that that breath flows only in and out of your nose. Slowly take a deep breath in, let your chest rise, your belly expand. Then as you exhale, feel your belly contract and your chest fall. Slow inhale through your nose. Let your chest rise. Let your belly expand. Then as you exhale, feel your belly draw in. As your chest falls, squeeze the breath from your body, nice and slow. As you sit here breathing into your hands, become very present and aware of the heat that your hands have. Start to breathe even deeper so that you feel your hands move with every inhale and exhale. Find the natural rhythm to your breath. Let it be slow, deep, and smooth. When you're ready, slowly bring that breath in through your nose for a count of 7. Inhaling, feel your chest rise, your belly expand, your ribs expand. Whole body filling with breath. And then when you're ready, exhale slowly through your nose for a count of 7 at your own speed. Again, becoming very present and aware of your hands on your body. Noticing the weight, the heat, and the energy from your hands as you breathe. And as you sit here breathing, slowly through your nose for a count of 7 as you draw that breath in. For a count of 7 as you let that breath go. Allow yourself to find a word of something that you would like to cultivate in your body or in your life. Perhaps love, peace, joy, gratitude. And as you take that breath in, maybe you can feel that sensation of that emotion growing. Getting stronger with every inhale. Bringing more love, more joy, more gratitude. When you're ready, slowly release your hands from your body and allow your eyes to open. Let your arms drop down by your sides. Then inhale as you bring both arms overhead. Reach to the sky, gaze to your thumbs. And as you exhale, gently bring your hands in front of your heart in prayer. Then again, relax your arms down by your sides. Slow inhale as you draw your arms towards the sky. Reach up, gaze up. And as you exhale, let your hands come in front of your heart in prayer. Once more, relaxing your arms down, then inhaling your arms overhead. Fill your belly with breath. Reach to the sky, gaze to your thumbs. And as you exhale, let your hands come in front of your heart in prayer. Release your hands to your chair base. As you inhale, extend your spine, raise your gaze to the sky, tilt your chin up. As you exhale, round your back, draw your shoulders forward, let your head come forward and down, tucking your chin to your chest. Slow inhale as you extend your spine, roll your pelvis forward, look up, tilting your chin to the sky. Then exhale, round your spine, tuck your chin, gently roll your shoulders forward. Once more, inhale, extend your spine, raise your face, look up, broaden through your chest and shoulders. And then as you exhale, round your back, tuck your chin, let your head bow forward and down. With an inhale, bring yourself back to center. Inhaling the right arm straight up into the air. As you exhale, gently arc your torso to the left. With an inhale, rise back to center. With an exhale, soften your body to the side. You can keep your gaze to your right hand, or if it feels better for your neck, look down. Move with your breath. Inhale, rise. Exhale, fall. One more deep breath in, rise up to center. Exhale, soften as far to the left as you feel comfortable. Look down. Really extend through that right side and breathe. Then with your inhale, come back to center. Slowly drape that right arm over your head. Keep that left shoulder down and exhale as you draw your head to the right. Feel the left side of your neck growing long. Left shoulder is weighted down towards the floor. Breathe. With every exhale, take advantage and gently draw your head a little bit closer to that right shoulder. When you're ready, allow your head to find the back of your head, and then exhale as you gently guide your head forward and down, dropping your chin towards your chest so that you feel the back, left side of your neck growing long. Breathe and let go. When you're ready, slow inhale, let your head rise up to center. Release that right hand down by your side. With an inhale, let both arms rise overhead. Fill your belly with breath. Reach to the sky, gaze to your thumbs. Then slow exhale, let your hands come in front of your heart in prayer. Release your hands to your chair base. As you inhale, extend your spine. Let your pelvis roll forward. Raise your gaze. Then exhale, round your back. Tuck your chin. Let your head bow forward and down. As you inhale, allow yourself to come back to center. Then next inhale, let the left arm rise into the air. As you exhale, gently arc your torso to the right, extending that left arm over your head. Inhale as you rise back to center. Exhale as you soften your body to the side. Move with your breath, each time going a little bit deeper. Inhale, rise. Exhale, soften. Once more, slow inhale, come back to center. Then exhale, soften your body to the right. Drop your gaze to the floor. Extend that left arm overhead. Reach through your left fingertips. Breathe into that left side. And then with a slow inhale, rise back to center. Exhale as you drape that left arm over your head and then gently draw your head to the left. Be mindful of that right shoulder. Keep it down. With every exhale, maybe you could draw your head a little bit further to the left towards that left shoulder, letting the right side of your neck grow long, using your breath. And then when you're ready, bring your left hand to the back of your head, and as you exhale, gently drop your head forward and down, chin towards chest. Feel the back right side of your neck lengthening. Breathe. When you're ready, slowly release. Let your head come up to center. Release that left hand down to the floor. And then inhale, both arms overhead. Fill your belly with breath. Reach to the sky. Gaze to your thumbs. Exhale as your hands come in front of your heart in prayer. With an inhale, extend your arms out away from each other. Squeeze your shoulder blades together. Raise your face. Tilt your chin up. And then as you exhale, let your right arm cross over your left. Wrap your arms around you. Give yourself a big hug, grabbing the backs of your shoulders. Take a deep breath in, and as you exhale, drop your chin to your chest. Let the back of your neck grow long. Inhale as you slowly roll your head to the right, dropping your right ear towards your right shoulder. Then exhale, gently bring your head back to center, chin to chest, soften through the base of your skull. As you inhale, slowly roll your head to the left, left ear to left shoulder. And then exhale, allow your head to come back to center, chin to chest, back of your neck grows long. Slow inhale, raise your head, extend your arms out away from each other, squeeze your shoulder blades together, broaden through your chest, raise your face, look up. And then as you exhale, bring your arms in front of you, this time left arm over your right, wrap your arms around you, give yourself a big hug. Take a deep breath in, sit up tall in your spine. And as you exhale, drop your chin to your chest. Head is heavy. Inhale as you roll your head to the left, relaxing your left ear towards your left shoulder, right side of your neck grows long. Exhale as you bring your head back to center, chin to chest. And then slowly inhale as you roll your head to the right, right ear towards right shoulder, left side of your neck growing long. And as you exhale, bring your head back to center, chin to chest. Slow inhale, let your head rise. Extend your arms out away from each other. Squeeze your shoulder blades together. Look up. Then with your next inhale, let both arms rise into the air. Reach to the sky. Gaze to your thumbs. And as you exhale, allow your hands to come in front of your heart in prayer. Beautiful. Now I want to take you through a progressive relaxation. Sit back in your chair and allow your hands to rest on your thighs, palms facing up. Gently close your eyes. Tune into your breath. Let it flow in and out of your body nice and easy. Relax. Bring your awareness down to your feet, and with your next inhale, point your toes as strongly as you can so that you feel that energy in your lower legs. Point your toes, take a deep breath in, and as you exhale, relax your lower legs. With your next inhale, I want you to flex your feet, Drive your heels away from you slowly as you bring that breath in. Lots of energy, lots of intensity. And then as you exhale, relax. Let that energy go. Bring your awareness now into your upper legs. And with your next inhale, squeeze your legs together, engage through your hips, feel your glutes engage. Squeeze as you draw that breath in, lots of energy, very strong. And then as you exhale, feel your muscles soften and totally let go. Now bringing your awareness into your arms. As you inhale, curl your hands into tight fists and draw your forearms towards your upper arms so that you're doing a bicep curl essentially. As you take that deep breath in, squeeze your arms, squeeze your hands, nice and strong, lots of energy. Then as you exhale, relax. Feel your arms totally let go, heavy, free of tension. Now bringing your awareness to your shoulders. With your next inhale, draw your shoulders towards your ears as high up as you can bring them. Squeeze them as you bring that breath into your body. And when you're ready, exhale, release. Let those shoulders relax down your back. Let it go. Finally, bring your awareness into your face. With your next inhale, I want you to contract, squint your eyes, squeeze your eyes shut, and maybe even purse your lips. Bring lots of energy into your face, like a deep scowl. Drawing that breath in. And as you exhale, feel the features of your face totally relax, going soft. Finally, we're going to do everything at once. When you're ready, deep, slow breath coming into your body. I want you to point your toes, squeeze your legs, draw your hands into fists, and then curl your forearms towards your upper arms. Let your shoulders rise towards your ears. Squeeze your eyes together, scowl your face. Lots of energy, super strong. And then exhale, let it all go. Feel your entire body sink into your chair. Allow yourself to grow very still, very relaxed. Let go of that deep breathing. Allow yourself to become very present and aware of your mind. This awareness and focus on your mind, I want you to envision a place, perhaps a mountaintop, a forest, a beach. I want you to start to focus your awareness on what you see, the colors, the landscape, shapes. Start to notice what you hear in this environment that you've chosen. The sound of the wind in the trees, the waves crashing on the shore. Start to feel the sensations of your environment. Perhaps the warmth of the sun on your skin, or the breeze in your hair. Start to notice if you can taste the salty ocean air. Perhaps you can smell flowers or rain. For a few moments, I want you to keep this image strong in your mind. And as you have this image in your mind, I want you to come back to that word that you chose at the beginning. Something to cultivate in your mind, your body, your life. More joy, more love, more peace.
And in this beautiful relaxation, keep your complete focus on your breathing. Become a little bit more conscious about each and every breath. And slowly allow yourself to go deeper and deeper within your own quiet space. And through each breath, connect with the physical body as if you are scanning the body through the eyes of the mind. And bring your focus to the area, that part of the body which is not at ease. Trust your instincts and sense your body talking to you. Bring your attention to that area, that part which needs your support. And if possible, put your hands on this area, or perhaps simply focus as the mind talks to the body. Thank you for enduring life's experiences so bravely. I am in gratitude. And I am sorry if I have ignored you or have taken you for granted. From now, I promise to stay connected, to take care of you, and to give you the love you deserve. Feel that mind-body connection, that harmony within, the communication within. And now as I count from 3 to 1, you will connect with memories where you have felt joy, peace, calm, gratitude. All those memories are within you in the depths of your mind. So let's connect with those. 3, 2, 1. Now, be there. Be there once again. Perhaps there is one special moment, or maybe there are many. sense these beautiful energies. These memories you are so grateful for. Soak it all in. And take 3 deep breaths. And using your imagination, with each breath, connect these positive energies to your heart. Through each breath, bringing these energies, creating a bridge, a connection to the body. And let your heart pump these beautiful energies to the body, especially sending these energies to the areas, to the parts which need this the most. Sense the inner equilibrium. The resources are within you. And now anchor this beautiful connection by touching the thumb of your hand with your index finger. One hand or both the hands, whatever seems natural. And from now onwards, whenever you close your eyes, take 3 deep lung-filling breaths, remembering the positive memories and connecting the thumb with the index finger. You are going to turn this beautiful circuit on. The positive mind-body circuit. And the more you repeat this exercise, the stronger the connection gets. Remember, the resources are within you to create that equilibrium. You sense it, you feel it. And with that beautiful feeling of gratitude, once again, focus at your breathing. Through each breath, connecting with the physical body in the here and now, with an inner knowing that a beautiful connection has been established. And with each breath, sensing and feeling more and more of those positive energies, bringing ease to the body. And as I count from 1 to 3, you will come back to the here and now with a beautiful smile on your face as the positive connection has been established. And you know it is all within you. 1, 2, 3. Coming back to the here and now, fully present.
Thank you, Megan and Dr. Gupta. Both of those were fantastic, and I hope everybody was able to enjoy it.
I wanted to just showcase one last thing
Absolutely. My
as a
apologies.
takeaway for our participants. So as you have all created that positive mind body circuit, you can continue to add on to the happiness pool by doing these very simple activities throughout the day. This is your happiness dose. The 4 chemicals which we need to hack to feel happy: dopamine, oxytocin, serotonin, and endorphin. And if you look at this very simple picture right in front of you, celebrating little wins, or hugging a family member, or your beloved pet, or giving someone a compliment, perhaps that someone is you. Try doing that. Give yourself a compliment. Look at yourself in the mirror and tell yourself, I'm so proud of you. This is the best release of oxytocin. With serotonin, connection with nature, meditation, music, and endorphin, of course, laughter. Watch those silly cat videos. Give yourself a dose of laughter. And continue putting in more and more energy in your happiness pool. Thank you so much.
Well, thank you so much, everybody, for participating. And I'm going to get right to the questions and answers. So if you have stuff, please submit them. And I'm just going to start asking questions for the panelists. Our first one was from Emily Cruz. She wants to know, how often and for how long does a cancer survivor need to practice yoga to see the benefits and fatigue, lymphedema, etc.?
The recommendation is always a daily practice, but we see benefits even in people who practice once a week. If your lymphedema is severe, a lot of patients will have trouble swallowing food if the swelling is significant. So if that's the case, I would do it every day. First thing in the morning is the best. And then if you're doing any kind of lymphatic drainage massage, it's easy to do that in the morning as well, like in the shower, is what I would recommend. But even as little as 5 or 10 minutes a day can make significant changes in swelling.
And just this one kind of goes off of that. Can you explain a little bit more on how yoga helps for lymphedema?
Yes. So the 2 ways to move lymph is either physical manipulation or external pressure of your muscles pushing against the lymph system to facilitate movement. So anytime you're moving your body, it doesn't have to be yoga. It could even be, going for a walk, using an elliptical. Any kind of physical movement is going to help facilitate movement of that lymph system. And if you had any kind of lymph nodes removed, or even the radiation fibrosis, just that lack of range of motion causes the accumulation of fluid. So movement is key. So with yoga specifically, we start with the deep breathing, which starts to open the channels for the lymph to drain. And then from there, anything you do with your arms moving over your head, you're changing the way that fluid is going to flow, just by moving your limbs and breathing at the same time.
Great, thank you. I know a lot of people keep asking where they can get a copy of these slides or this presentation, and this will be sent out to everybody who registered the recording of this presentation. So the Head and Neck Cancer Alliance will be getting that to you. Another question, probably for you, Megan, is any specific yoga pose that's beneficial for somebody suffering from dry mouth?
Oh, dry mouth, though, as the dietitian, I recommend like moist cooking methods, everything cooked in like some kind of broth, juice, that kind of stuff. And then you can always use extra sauces, gravies. I'm a fan of just, extra virgin olive oil drizzled over food, because that oil will help coat the inside of the mouth to keep it moist. But definitely, braising meat or boiling meat, soup, smoothies, things that are just naturally full of moisture and fat will help keep that lubrication, since the saliva isn't there to help. So yeah, I just recommend extra moisture in your food preparation. I don't know if there's any yoga for that, but the hypnotherapy is effective for dry mouth.
Yeah, Dr. Gupta, do you have any comments on that?
Yes, absolutely. Thank you so much for handing the baton over to me, Megan. As what we experienced just now, to counter the negative, we create the positive and we keep on strengthening the positive circuit. In the same way, Dr. Mahadevan did say that in her slide, when we believe we are getting better, the body responds. So through simple suggestions, we can create that circuit as well through your past cellular memories where you have experienced the moistness of the mouth. That memories are still in your cells. So by connecting the mind and regressing the mind to those memories, that circuit can be reestablished. And that is a part of our current research project at LSU as well. And we have, I've tried this particular session with a few head and neck cancer survivors, and they immediately felt the difference just by listening to that particular suggestion. So the more we listen to it, we revive the old cellular memories. Yes, absolutely. The mind is our biggest resource.
Another question we have from one of our survivors, Katie Lee, she says she's suffering from a lot of lymphedema in her mouth, jaw, and neck, which is keeping her awake at night. Is there any massage techniques for the inside of the neck or the mouth?
Yes, there are, and I can send those resources so they can be posted on the website. There's a ton of good information about self-lymphatic drainage massage specifically for the head and neck that can be done, like I was saying, like 5 minutes in the shower, that can really, really make a difference. And to help, the body will reroute that lymphatic drainage system. It just takes time. But in the meantime, the swelling impacts breathing, speaking, eating, drinking. So it's very important to do it, anything that we can. So I'll send resources for that, for self-lymphatic.
Awesome, thank you.
Thank
There was
you.
also a question, probably for all three panelists. What tips do you have on accessing some of these resources when your oncology practice doesn't offer them where they're at? Their comment, they're so thankful for their team, but felt like they haven't had a lot of help after treatment.
One of the last slides that I posted, which we'll share on the website, was all the different resources and national organizations where you can search for accredited hypnotherapists and yoga therapists, as well as Dr. Gupte by zip code. And I will post those websites and resources.
Great, thank you. Somebody also asked, I'm just wondering if a spiritual connection or belief in a higher power can have similar effects or can replace the hypnosis option. Any comments on that, Dr. Gupta?
A very good question. I would say whenever we believe and we pray, we are in that altered awareness. We are in the subconscious. So it is just a tag. So prayers, you can sense, are those powers which make us believe and miracles happen. So you call it hypnosis, you call it, connection with the divine, you call it connection with the universe. It is all that belief which comes from within, which makes the changes. Hypnosis, of course, to use it in clinical practice, we are very mindful of the person's belief system and what type of suggestions to give and what not. But again, the whole idea is what we consciously cannot achieve. We want to believe in the higher power to do it for us. So yes, I would say that it is all the same, just the tags are different.
Great. I think a lot of these other ones are again regarding resources and how to find people within their own community. So again, we'll have that up on the website and we'll have these presentation also there. Somebody's asking how they can be a part of a study if they were interested. I'm not sure if LSU is expanding outside of their patient population or not, but.
The nonprofit organization, which I have established, and Dr. Mahadevan is a part of that as well, our one big pillar which we want to move forward towards is to do research. So we will be calling out and perhaps connect with us and write into us. And when we start our study, we'll reach out to you.
A couple questions people have that kind of like in the moment when they're experiencing things like these Charlie horse type like pains or just or really cramping. Megan, do you have any tips for how they can kind of recenter themselves, or is that a good time for them to stop and do some different yoga techniques to try to help?
Yeah, anytime you have a spasm of the muscle, I would be careful to try to take it into a stretch because that can just make it spasm more. So usually I would, if your neck was spasming on this side, I would elevate my arm, kind of shorten the distance, give it some relief and put heat. Yeah, and relax it. And then once it starts to feel not so tight, then you could do some overall, gentle yoga. But if it's in a spasm, I wouldn't try to just stretch it cold. I would use heat, shorten that muscle, let it kind of relax until it doesn't feel like it's in such a strong spasm. Um, there's a lot of good self massage techniques too that I'll share the resources where you can kind of get in and do some cross fiber friction and some gentle effleurage to kind of get that area to relax. But it can be dependent on what's going on, if it's scar tissue or postural, but heat, definitely heat.
Another question, maybe for you, Rupa, is we have a couple young adult cancer survivors on this meeting, and just out of curiosity, I've been wondering, have you seen any differences in interventions between young adults and older adults? Or if anybody has a comment.
So when it comes to mind body therapies, we know it really works for a gamut of ages. Pediatric patients respond very well actually to yoga and hypnosis. And one of the reasons is you're more suggestible at a younger age, and adolescents as well as older youth have also, some of the studies that have been done have been anywhere from 18 to 75 in the yoga and hypnosis space. So a lot of the recommendations we have is for all the age groups.
Great. And is there any particular techniques that you guys recommend and hopefully maybe include in the resources for massage for scar tissue?
Again, if I have to say, today a mind-body connection has been established. Please talk to the body on daily basis. When you wake up, have that inner scanning on. Your body is going to give you a message. The place which has this scar, please send that energy of love to the body. And again, as I said, being in this field and practicing clinical hypnosis for over 9 years now, I have seen some amazing things happening when the mind connects with the body in a very positive connection. So that will be my take on it. I'm pretty sure everyone has their own golden nugget to share.
The typical massage technique for scar tissue is cross fiber friction. It can be somewhat uncomfortable, especially depending on how far out the patient is from healing, from surgery. So always check with the surgeon and the oncology team before doing anything like that. But generally it's cross fiber friction, so it's going to go against the grain of the scar to try to break up the adhesion. You wouldn't use a lot of lotion or oil. It would be kind of just a dry manipulation of the tissue, and it would be at your comfort level to just try to, like, with the idea that you're trying to break those adhesions up. And again, it doesn't have to be a lot. Even just 2 minutes daily over time will change that adhesion and give it less fibrosity. And then of course, then you can do stretching, but that'll be one of the resources that I share is some self cross fiber friction for scar to help with scarring.
Great, thank you. I think we have a lot of great feedback for all the panelists, and everybody really enjoyed this session. I don't think I see any last minute questions. If anybody does have a last minute question, please feel free to raise your hand, or I see some messages. Just a lot of thank you, and thank you to our panelists.
Thank you so much. Just continue to believe in the power of mind. That is what I would like as the take home. It's all within. and we can do the changes. Even what Megan was sharing, when you're addressing to these scars, just believe that your body can heal, because the body has the power to heal. The mind has to be convinced.
All right. Well, again, thank you to all of our survivors and caregivers for attending today. Special thanks to the panelists for an amazing session, as well as our Head and Neck Cancer Alliance and the American Head and Neck Cancer Society for their time in organizing and hosting this event. In the chat, I put down both the website and an email address that you can see send any more questions to. And again, we'll be sending out a recording of this to everyone who registered. Hope you all have a great day.